1. What is the appropriate method to open the airway of an unconscious trauma patient with suspected spinal injury? A. Head tilt chin lift. B. Jaw thrust maneuver. C. Hyperextension of the neck. D. Blind finger sweep. Two. A patient with a complete airway obstruction is unconscious. What is the first step you should take? A. Begin chest compressions. B. Deliver abdominal thrusts. C. Attempt a blind finger sweep. D. Perform a head tilt chin lift. Three. When using a bag valve mask or BVM to ventilate a patient without an advanced airway, what is the recommended ventilation rate? A. 8 to 10 breaths per minute. B. 10 to 12 breaths per minute. C. 20 to 24 breaths per minute. D. 4 to 6 breaths per minute. 4. What is the primary purpose of a nasopharyngeal airway or NPA? A. To prevent tongue obstruction. B. To fully secure the airway. C. To be used only in unconscious patients. D. To stop bleeding in the nasal passage. Five. When should you remove a foreign object from a patient's airway? A. Only if it is visible. B. Always attempt a blind sweep. C. After ventilating the patient. D. After securing an advanced airway. Six. What is the first-line treatment for ventricular fibrillation or VF? A. Epinephrine. B. Defibrillation. C. Amiodarone. D. CPR only. Seven. Which of the following patients requires immediate transport to a hospital with a cardiac catheterization lab? A. A patient with stable angina. B. A patient with suspected ST elevation myocardial infarction IR STEMI. C. A patient with resolved chest pain. D. A patient with a mild arrhythmia. Eight. A patient is in cardiac arrest and has been in asystole for 10 minutes. What is the next step? A. Defibrillation. B. Epinephrine administration. C. Synchronized cardioversion. D. Wait for medical direction. Nine. Which of the following is a contraindication for nitroglycerin administration? A. Hypertension. B. Recent erectile dysfunction medication use. C. Tachycardia. D. Mild headache. Ten. Which of the following symptoms is most concerning in a patient with suspected heart failure? A. Pedal edema. B. Shortness of breath when lying flat. C. Hypertension. D. Mild dizziness. (11) A patient with a suspected tension pneumothorax should be treated with A. Positive pressure ventilation. B. A needle decompression. C. High-flow oxygen only. D. A cervical collar. (12) Which type of shock is most commonly caused by severe bleeding? A. Cardiogenic shock. B. Hypovolemic shock. C. Neurogenic shock. D. Anaphylactic shock. (13) What is the most common early sign of shock? A. Hypotension. B. Bradycardia. C. Tachycardia. D. Cyanosis. (14) A trauma patient with paradoxical chest wall movement likely has A. A pneumothorax. B. A flail chest. C. A pulmonary embolism. D. A tension pneumothorax. (15) The best way to control severe external bleeding is A. Direct pressure. B. Tourniquet application. C. Elevation of the limb. D. Packing the wound with gauze. (16) Which condition presents with sudden, severe abdominal pain radiating to the back in an older male? A. Appendicitis. B. Aortic aneurysm rupture. C. Gallbladder attack. D. Kidney stones. (17) What is the most immediate concern in a patient experiencing a severe allergic reaction? A. Rash development. B. Hypotension. C. Airway compromise. D. Nausea and vomiting. (18) Which sign is most specific to a stroke? A. Sudden confusion. B. Sudden chest pain. C. Bilateral pupil dilation. D. Increased heart rate. (19) What is the first medication administered to a seizing patient? A. Epinephrine. B. Diazepam or midazolam. C. Atropine. D. Insulin. 20. Which patient is most at risk for hypoglycemia? A. A diabetic who missed their insulin dose. B. A patient with hyperthyroidism. C. A diabetic who took insulin but did not eat. D. A patient who had a stroke. 21. The most immediate treatment for a prolapsed umbilical cord is A. Delivery of the baby. B. Elevating the mother's hips and relieving pressure on the cord. C. Cutting the cord. D. Applying a dry dressing. (22) What is the normal respiratory rate for a newborn? A. 10 to 20 breaths per minute. B. 20 to 40 breaths per minute. C. 30 to 60 breaths per minute. D. 60 to 80 breaths per minute. EMT. An emergency medical technician or EMT is a highly trained healthcare professional who provides urgent medical care in emergency situations. EMTs are often the first responders at the scene of accidents, medical emergencies, and disasters, delivering critical pre-hospital care to stabilize patients before transporting them to medical facilities. Their responsibilities include assessing patients, managing airways, performing CPR, controlling bleeding, administering medications, and using life-saving equipment such as defibrillators. EMTs work in diverse and high-pressure environments, including ambulances, fire departments, and hospitals. Their quick thinking, medical expertise, and ability to remain calm under pressure are essential in saving lives and ensuring patient safety during transport. Here are 5 top beneficial uses of EMT. 1. Rapid emergency response. EMTs provide immediate medical care at the scene of accidents, natural disasters, and medical emergencies, helping stabilize patients before they reach the hospital. 2. Life-saving interventions. They perform critical procedures such as CPR, defibrillation, bleeding control, airway management, and medication administration, increasing survival rates for patients in critical conditions. 3. Pre-hospital patient assessment and care. EMTs assess patients on site, determining the severity of injuries or illnesses and initiating appropriate medical treatment to prevent deterioration. 4. Safe and efficient patient transport. They ensure patients are safely transported to hospitals while continuously monitoring and providing necessary medical care en route. 5. Support for healthcare systems. EMTs reduce hospital overcrowding by treating minor cases on site, assisting in disaster response, and working alongside paramedics, nurses, and doctors to enhance patient care.